Powered by the Montana Television Network. This is the Noon News from Montana's news leader.
Good afternoon, everyone. Thanks for joining us this Thursday. I'm Jeanelle Slade. A Stevensville man charged with killing his mother and the mother of his children while high on cocaine pleads not guilty. Logan Dallas Christopher, shown here in court on March 12th, is charged with shooting 25-year-old Marissa Wall in the back of the head and then killing his mother, 47-year-old Tiffany Green Slade. He is also charged for allegedly shooting at his father. At Wednesday's hearing, Ravalli County Attorney Bill Fulbright added a charge for criminal possession of cocaine with intent to distribute. According to court documents, officers found more than $7,000 in cash, cocaine, and packaging materials in Christopher's home and car. Now, the judge continued Christopher's bond at $2 million. Well, 10 more Montanans are confirmed with COVID-19 this afternoon. There are currently 227 confirmed cases across the state. That's up 10 since last night. The total number of deaths remains at 5. Now, Gallatin County, with the highest number of cases in the state, is now up to 85. Yellowstone County with 34. Flathead County now at 17, and Missoula County with 16 positive cases. So far, 19 people have been hospitalized. Yellowstone County picked up just one new case yesterday. Now we take a look at this county's County health leaders also say coronavirus cases aren't expected to peak in Montana until April 25th. A model used by the Trump administration projects the state will see around 9 deaths a day. By June, the death totals in Montana could be as high as 270. If the projections are correct, the state would have enough hospital beds, but it would be short on ICU beds. The model predicts Montana will need 100 ventilators at the peak of hospitalizations. As a reminder, the CDC lists fever, cough, and shortness of breath as the 3 most common symptoms of COVID-19. Now, the agency says if a person's lips or face appear bluish, or if they have trouble breathing or persistent pain or pressure in their chest or experience confusion, they need to seek medical attention immediately. Now, older adults are at a higher risk to become severely ill from the virus, and people of all ages with underlying medical conditions could experience more intense symptoms. Well, as the healthcare systems become overwhelmed from the influx of patients, health experts are asking for help. MTN's Megan Mannering takes us to Missoula to find out how one school is stepping up.
Hospitals across the country are desperate for supplies, and as many prepare to reach capacity, they're calling for all hands on deck. Answering that call are students and staff right here at Missoula College.
But we've really never been pressed with such an urgent situation as we are now. So it's really asked us to do some out-of-the-box thinking.
Dan Funch is the chair of the Department of Health Professions at Missoula College. He says programs have rearranged schedules for classes and clinicals, driving students into the area workforce as quickly as possible. They've done this in conjunction with programs across the state, even working with the Montana Board of Nursing to modify some of the board's rules.
One of the things they've done is roll back the requirement for clinical experience, and they're allowing programs to use a little bit more simulation instead of direct patient contact experiences. The other thing that they're doing is the board has extended the temporary licensing for nursing students.
But that's not the only way Missoula College is lending a hand.
There are a few small ways that we can offer some material help. We have a surgical tech program that's been able to donate back about 1,000 pieces of protective equipment that frontline healthcare workers could use. We also have a respiratory care program. The program routinely uses ventilators to train students, and we have about 4 of those ventilators that we have offered to area facilities in the event that they need them.
Funch says everyone has a role to play in fighting this virus. Missoula College is no exception.
We're really kind of leaving no stone unturned and trying to see what we can do to get creative and be part of the solution here.
In Missoula, Megan Mannering, MTN News.
In the event Missoula County's hospitals can't accommodate the number of coronavirus patients, Missoula College administrators are also offering space for potential overflow. Well, it's now time to check in on the weather scene, and Rob Gregg's the perfect person to bring us something happy and some sun today.
Well, thank you very much. I will accept that gladly, and now the weight is on my shoulders to do something with what's happening outside. No pressure. Yeah, we've had another taste of winter. It's the 2nd of April. Kind of felt like the 2nd of January out there. And if you look at the national picture right now, you notice that big lobe of cold air and wintry weather from, I'd say Idaho all the way down into Colorado and Utah and swinging over toward North Dakota. Yeah, that's us right there in the middle. The good news is it's going away. The folks in Minnesota are going to have that pretty quick as that wintry weather continues to move off toward the east. You can see the cold air right now sagging down all the way into Wyoming, but it's taking that snow away from us, and warmer air is on the way in from the west. And we've also got a couple of advisories that have expired even since I built this map. That's good news too. I'll explain why with the complete Q2 Storm Tracker forecast in just a minute. Jeanelle.
All right, thanks so much, Rob. Well, the coronavirus outbreak is affecting almost all aspects of the economy, and now it's upending the political world in one of the biggest elections Montana has ever seen. A month ago, candidates were for statewide offices prepared for the home stretch to the June 2nd primary election. Well, now everything has changed.
I only know one way to campaign, and that is to get in front of people and try to, talk to people and have debates. All of the debates have been canceled. It's difficult on every front because what used to exist, even in terms of being able to communicate, has all changed.
I'm spending a lot of time talking with Montanans, making sure they're okay and seeing what questions they have, trying to serve as a resource to them.
MTN News will, of course, bring you more coverage of the contested statewide primary elections in the coming weeks. Well, opting to keep voters and poll workers safe, Ravalli County is now the latest Montana county to move to an all vote by mail election for the June primary. This week, Ravalli County commissioners approved the recommendation to conduct the June voting entirely without polling places. In effect, that means everyone will be voting absentee. Voter registrations is being extended so people can sign up online later into May, and early voting will be available as soon as the ballots are received. Additionally, the county will pick up all of the postage.
However you feel about mail-in ballots, this was done for everyone's safety. We don't want anybody getting sick. I don't want my staff getting sick, my election workers, and I most certainly don't want our voters to get sick because they voted. So we much prefer that they do it at home.
We have more ahead on the noon news. We take a look at the idea behind the Hearts for Healthcare Workers and First Responders in the city of Whitefish. And Rob's in next with your forecast.